Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Jay Calvert. Today, here on a Friday afternoon in Beverly Hills with my incredible co-host, Dr. Millicent Rovelo. How are you, Dr. Rovelo?
Excellent. How are you?
I am doing really well. I am happy to do this podcast because lately just had some moments where I said, shouldn't you have thought about this before surgery? Like I feel for my patients. And when they're going through it after surgery, I feel like, boy, didn't we talk about this? I thought we talked about this before surgery. Did we not talk about the fact that plastic surgery doesn't heal instantaneously? Did we not talk about the fact that you're going to be swollen after surgery? Did we not say it takes about a year to get the final result on a rhinoplasty? Do we not tell you it takes a while for breast implant? Like, all those things come up in the first 2 to 3 weeks after surgery. And I'll tell you, my patients have like anxiety attacks of earth-shaking magnitude.
Yes. The subtitle of this podcast is Talking Your Patient Off the Ledge.
It's true.
And
it's like,
it is.
Whoa.
It is a very, very real thing that I think plastic surgeons out there will 100% agree happens across the board with the whole spectrum of patients. And I get it. There are so many reasons why this happens. And so what we're talking about is just this really acute anxiety that happens in the first few weeks after surgery. Even in patients that know they're going to be swollen, even if cerebrally they know that they're going to be swollen for some time.
And they've read the paperwork.
Or they know that after a facelift, they're going to look a little funny for a while, or that their breasts are going to take time to settle. If you were to really get into their brains, they know this, but it's not about what they know. It's about this anxiety regarding the whole process and their results. So preparing for this time period after surgery actually starts before surgery.
Yeah. And this is the thing. I'll be sitting there before surgery and the patient's like, yeah, totally. I get it.
I listen to your podcast,
yeah, I
doctor.
listen to the podcast. I understand. It takes like a year to get the final result. Well, so let's break it down. If it takes a year to get the final result, then how do you think it looks in the first 2 weeks after surgery? Do you think you're close to your final result in the first 2 weeks? If it takes a year and you just had surgery, this is where I want to I'm trying to bring this home for my patients before they have surgery. And I'm not sure how to do it. I'm hoping this podcast will help and that when they listen, they go, that makes sense. Because when you disrupt everything with surgery, it's going to swell, it's going to look different, it's not going to be fully healed, it's not going to settle down. There are stitches holding things together. All that should, but it doesn't. It should add up to the patient that it's not going to look normal.
Right. It's not going to look normal in the beginning, and this is not the time to look in the mirror and critique your results at all.
That's a good point, because my original coordinator, Raquel, when I quit working for the University of California and went into private practice in the time before electricity. Actually, there were pterodactyls flying at this point. She would say to the patients, look, if you want to make this easy on yourself, cover all the mirrors for 3 weeks after surgery. Just put a sheet over all of them and throw away your compact. Don't look in the mirror. And then after 3 weeks, you can take those sheets down and it'll look pretty decent.
Right. And that's assuming you have a surgeon that's following you closely and is looking at you every week and
100%.
is able to point out if there's anything potentially going wrong. If you have a surgeon that pieced out, then maybe you should look in the mirror.
Yeah, you need somebody who's on top of it with you. Absolutely.
Not a blanket statement. But if you have someone who's following you closely, let them worry about anything that could potentially be going wrong in the first few weeks. And what I like to say to patients beforehand, all the same things that you just said. It takes the time and the swelling, and this is your time course, and you can expect, at 6 weeks to be 80% there. Or I kind of give them time frames. But also, I kind of try and, if I can, get a read on them in terms of their baseline anxiety level. Some patients are very forthcoming and will flat out tell me, I'm a very anxious person. I'm worried about how I'm going to be afterwards. And these are patients that either ask me directly or I might subtly suggest maybe taking an anti-anxiolytic right after surgery would be helpful, because there are a lot of things about the surgery process that are anxiety provoking.
100%.
Even in someone that maybe doesn't think they have anxiety issues. But the cocktail of drugs you get when you have anesthesia can have effects that maybe you don't anticipate, residual effects. If you're someone like me who is never, ever anxious and manages to suppress all anxieties at all times, sometimes they come out after surgery because, like, the drugs have opened up your ability to feel and, like, understand things. So there are all kinds of reasons why people might get sort of this acute anxiety panic attack situation after surgery. And we've all gotten the phone calls, like, the night of surgery, like less than 12 hours after surgery, of the patient actually having a panic attack and having issues. So
Oh, yeah.
if you,
I've had some goodies.
Oh, I know. So if you at all know that there are any kind of issues at baseline, have a plan in place before surgery. Talk with your surgeon about it so that you're not ending up,
Up on the ledge.
up on, like, literally and figuratively up on the ledge.
Yeah, the medications I give patients includes Valium.
Yes.
It includes Valium.
For a
And
reason.
it's not a suggestion. Like, you need it. I promise you. There's a reason I give every patient Valium, because they're going to look and be like, oh my God, what have I done?
I know.
It is like without
Yeah.
a doubt, because you can't imagine if you're a normal person going through life and you're working in a job and you're buying groceries and you're taking care of kids and you've got pets and you're going to the ballpark on the Saturday, or you're doing a soccer mom thing, or you're doing whatever you do. You're never sitting there going like, I wonder how bad I'm going to look after surgery. So you show up for your operation,
Right.
and then you get hauled off to surgery and everybody's really sweet. Oh, it's going to be great. You're going to love it. And you wake up and you're like, oh my
Oh
God,
my
like, I
gosh.
don't love this. Like, what is this that's going on here?
Yeah.
It is so disconcerting.
I
And
know.
that's why we're doing this now. For those of you who are going to sign up for surgery, it's not that the problem isn't how you look. The problem is your response to how you look. You're going to look that way.
Yeah.
Surgery doesn't heal overnight. So your response to how it looks can either be like, oh yeah, they told me I was going to look like I got hit by a bus. I pretty much
Yep.
do. That's right. And then it gets better. And then a week, like, that's why rhinoplasty, I send them home for a week. I'll see you back in a week. And then when they come back, they're like, God, it was looking pretty bad at day 3. I was like, hell yeah, it was. That's why I'm seeing you at day 7, because how does it look now? Well, it looks pretty good. The
Right.
bruising's going away and, swelling's gone down. And like, let's pop this off. Oh my God, I love it. Yeah, exactly. So that's where being in the know of what's going to happen will help alleviate that anxiety, because the anxiety is stress, and the stress lowers your immune response, which lowers your ability to heal wounds, to fight infection, and to have a great result. So the anxiety is not here because, we're happy to take your phone call and talk you off the ledge, but it takes a while to get to that point. So all that stress is not necessary.
Yeah.
So we're doing this so that when, in the most empathetic and kind way possible, you can understand, like, you don't have to feel that way and you don't have to have that response to how you look, because it is going to get better. And that is how you're supposed to look. And yes, surgery makes you look very different, and it doesn't heal overnight. That's why I always say with facelift patients, I take the pictures at 5 months. Everything before that, there's nerve weaknesses. There's, scars that are kind of coming together. There's swelling in one side or the other. There was a little hematoma or something you had to drain. Like, that's all normal. Noses, same thing. Like, taking pictures at 4, 6 months, 8 months, like, it takes a while for these noses to heal.
It takes a long
Primary
time.
and the secondaries take even longer. The revision rhinoplasties take longer. Facelifts, 5 months. Noses, a year, 2 years. Breast surgery, 3, 4, 5, 6 months. It all takes time.
Right. And I think sometimes the anxiety that these patients have is because, they were planning on getting back to their regular life within a week. Because, they ask us, and we'll say, oh, you have some pain and discomfort for a week. And I think we try and tell them about the swelling and the bruising. But maybe in their mind, they just hear, oh, I'll be recovered in a week. I can go back to work. I can go back to doing all these things. And you can go back to work. You can go back to picking up the kids. You can do all these things.
You just look a little funny.
But you're going to look a little funny. So there are two things that you can do. You can just absent yourself from society until you feel comfortable. And maybe you're not doing your Zoom meetings. Maybe you're not going out in public. And you just have to sort of budget yourself for that. Or you take the effort attitude, which is like my response to surgery, and show up, and do your life and go, what? So you got to figure out.
You scare people.
I do. It's not nice.
You just go in like, okay, we're doing surgery today. What? Is it? You got a problem? What? Oh, this?
Is there something in my teeth? Like,
It's gonna be fine. No. I just had surgery. I'm fine. Lasers, whatever. Too bad.
Yeah, just deal
Get
with
over it.
Yeah. So you got to figure out what works for you, but know that people are going to notice that something's happened if you do something, certainly within those first few weeks after surgery. We're talking about obviously face and nose surgeries. If you have a body surgery, a breast surgery, you can sort of camouflage what's going on there a little bit better. But for face surgeries, you're going to look a little different for a while.
And we did a whole podcast on nostril asymmetry.
Oh, yes, we did.
Because no nostrils are symmetric on any human being alive. And when they're swollen after surgery, they certainly don't look symmetric. And so the amount of time I spend on nostril asymmetry, and now I just say, oh, you got to go listen to that podcast. Yeah, your nostrils aren't going to be the same. But listen to this. This will help you. Because mine aren't the same. Yours nostrils are not the same. I was going to say something about it, but I didn't want to.
Thank you.
But I mean, nobody's nostrils are the same. And everybody has a small side of their face and a big side of their face. Everybody. So everybody's going to have facial asymmetry. Everybody's going to have different degrees of tightness on one side after a facelift versus the other side because it's just the way that we're built. We're not built as, steel and plastic people.
Right.
Not yet. I mean, I think that's coming, and but it's not now. Right now, people are made out of like bone and skin and
fat juicy stuff
and cartilage and blood and stuff like that. So it's like while you're made out of human stuff, you're going to heal like a human, which is unpredictable. And our job as surgeons is to control that as much as we can, with the caveat that and it's going to still be asymmetric. And it's still going to be different one side to the other because you're different from one side to the other before you even begin this journey.
Right.
So if you have that in your back pocket going in, it will alleviate a lot of those, moments of just like, oh my God, I can't believe I did this. What do I look like? I look like, like something out of, a war movie. Like, yeah, you kind of do. You kind of do. That's the way it is after surgery.
And we hear that I know you and I both hear that from our patients. And I was in the elevator in our building, which is mostly plastic surgeons. And I was sharing the elevator with a lady in a wheelchair. She was clearly like post-op day number 1, coming in for her first post-op check. And she was all wrapped up and she had the sutures in her eyelids and her whole face was puffy and bruised. And she looked like she had just gotten a facelift day 1. That's what she's supposed to look like. And she's freaking out with her daughter, whoever's there with her. Oh my God, what have I done? And I was like,
totally it.
Yep, that sounds about right.
It's like
they all say it. Yeah.
It's really hard to go through and it's hard to understand. So that's why if this podcast can help anybody break their anxiety so that they can just go, okay, I got it. Yeah, this is what they said about.
You know what Sean, you know what we should do? I'm going to send you my post-op day 1 photos. And we're going to tag it on this.
Of you?
We need to start putting more photos of post-op day 1. You're going to look like a pumpkin head.
You looked ripe.
Mm-hmm.
You were like,
that's what it is.
You were down for the count.
I think maybe people can get like a visual of like.
Yeah, it didn't stop you doing surgery though.
I know. Sorry, but yeah, that's helpful. I think to know.
Yeah, I mean, people look rough, and that's part of the deal. You can't get to the promised land by you got to go through the valley.
Go through the wilderness. Yep.
You got to go through the valley. Because you just have to know that it's gonna result in a great operation for you with a great result, but it doesn't heal instantly.
Yes, exactly.
Well, is there anything else you want to add for our patients who might be up on the ledge right this minute? Because hopefully
take a step back,
take a breath, relax. You're gonna get there. It's
Take your
going to chunk,
Valium.
right? Take the Valium. Take drugs. We're recommending that for this instance only.
Yes.
All right. Well, in that case, this is the Beverly Hills Plastic Surgery Podcast coming to you from the very cool, very chill Anxiolytic 90210.